Well, good evening, everyone. I'm Joe Gazen.
And I'm Leslie Adamy. Thank you for being with us. At the top tonight, we continue to track the spread of the novel coronavirus across Texas. Now, this goes beyond just looking at case counts, right? We know those are increasing, and it's also important to look at things like hospitalizations, the availability of ICU beds, ventilators across the state. Texas is now seeing 1,048,303 confirmed COVID-19 cases since the start of the pandemic.
Well, here at home, Nueces County reporting 172 new cases today. That's just in one day. It's now more than 22,500 since the infections first began back in March of this year. Members of our local COVID task force believe that we're just at the beginning of a new surge, and they predict it'll be worse than the one that we saw in July and August.
3 News reporter Michael Gibson explains where we are right now and when those experts think we'll see the peak of this new surge in cases in tonight's top story.
These graphs show what our COVID-19 numbers look like here in Nueces County. Since March, we've had over 22,300 COVID cases in total. Nearly 21,000 of those people recovered. You can also see here that we now have over 900 active cases and just over 460 deaths. Our COVID task force reports that our daily hospitalization numbers are on the rise. The bar graphs show that just 10 days ago, that number hovered around the 60s. Now we're well over 100 a day. And the number of COVID ICU patients has also risen from around 20 to now 30 each day. You can also see that over the last 2 weeks, we've been seeing more people dying, with 14 people losing their lives to COVID-19.
We are, obviously going to need to understand that holiday gatherings can take that curve and really bring it up another notch. If we can keep where we are right now, Michael, keep that level and continue to drive it down, that's what's needed.
Nueces County Judge Barbara Canales talking about the COVID-19 task force's prediction that we are headed for the biggest surge in COVID numbers that we've ever seen. Here's a comparison graph showing the July and December time periods. The task force believes right now we are at the beginning of the second wave, with our COVID numbers looking similar to what they did back in mid-June, just before the July surge. That COVID-19 outbreak is supposed to peak at around Christmas time.
I'm concerned because we have a baseline that has 100 people in the hospital. If we have this surge, it doesn't start down here. It starts from here and then builds up. And so I've got to ask for our, of course, our faith to keep us strong, and our hope and, optimism for the vaccine to be, at our side. But we need action from the citizens to say, that's not a good idea right now. I can't do that.
Also, you can see that the task force PowerPoint presentation shows here that our transmission rate is at 1.8. That means for every person that is infected, they get an additional 1 to 2 people infected. Now, there is some good news on the treatment front. The first shipment of a new antibody therapy has now arrived in town.
So Bamlanivimab is the new antibody drug. We have received 38 doses. The drug is located, I believe, all at Christus Health Shoreline.
The new antibody therapy is to treat COVID-19 patients who have mild to moderate symptoms. It's designed for patients 12 years of age and older. High on the dosing priority list are those folks who are 65 years of age or older and have certain chronic medical conditions that could result in hospitalization if they don't get that therapy. Michael Gibson, 3 News.